Hi, I'm personal trainer Daniel Robertson. In my series titled Corrective Exercise and Posture for Lower Back Pain, this video will speak specifically to the average 5'4" woman. The overall goal is to learn how to properly align your pelvis relative to your legs and spine, and then integrate this into all phases of pain-free stance and movement. Often due to pregnancy, menopause, and weight gain, the pelvis will go into this anterior tilt, and this leads to an unwelcome pooch, inguinal hernias, low back strain, SI joint pain, and sciatica. Without proper intervention, this progresses into premature bulging discs, as well as bone spurs and osteoporosis. There are two main reasons that causes tight adductors, the inner thigh muscles, as well as the iliacus, that both get too tight from sitting too much or sitting wrong. And then when a person stands up, the pelvis no longer stays in this position. It starts to get tilted down. And the number two reason is that these external obliques are not being trained enough, as well as the lower six pack, to counteract the overactivity of that psoas or iliacus, as well as the adductors. So there's three different exercises that are also assessments and mobility exercises that you can do on a daily basis simply using a door jamb or laying on your back. To determine your specific situation, apply these on a daily basis to check to see how you're improving. So the first one will be simply putting your lower back up against the door jamb, using your lower abs to do so, and then relaxing the glutes and slowly bending your knees a little bit as you go down and flattening your lower back with your abs tied here. Keep your knees slightly bent and your feet pointed straight. And then feel the stretch in the inner thigh as well as strengthen your abdominal muscles. Use your hand to help brace yourself so you have a strong position. And hold that for at least 1 to 2 minutes several times a day. The next one will be you putting your leg behind you to stretch your iliacus out as well as the iliopsoas. And again, you flatten your lower back to protect your lower back and SI joint. And if you can't get your knee behind your hip pretty easy, that means your iliacus is probably pretty tight and you need to strengthen your abdominal muscles as well as stretch that out at the same time. So the same process of bracing strongly and holding that. The third assessment is simply laying down on your back to assess your strength of your lower abs. And generally, if you can flatten your back, as most everyone can do, you should be able to lower your legs at least 45 degrees. If you can't get there and your lower abdominal muscles pop up or your lower back pops up, you need to really strengthen your lower abdominal muscles. So I like to start with the knees directly over the hips, pretend that my knees are at 12 o'clock, and then roll my pelvis over. As I do so, I use my left external obliques and abdominal wall as a whole, and then I go back to 12 o'clock, and then roll over towards 1 o'clock, and repeat this slow rolling process over and over for at least 1 to 2 minutes until your abs are burning, and then eventually they fail and get stronger. So make sure that you can use your assessment to see how far you can go without your lower back popping up like this. Thank you for watching, and be sure to check out my other posture videos.
Additionally, be aware to not load your toes, lock your knees, round your back, or poke your head forward, as this can prevent pelvic correction.